It's quite exciting that now you see a catheter on the market that's part of the third generation of catheters. The sort of second generation catheters that have the hydrophilic coatings that contain PVP, they certainly have eased the use of patient insert in the product, but there's a huge issue surrounding what's called as catheter coating dry out. Really, if you think about intermittent catheters are used multiple times a day, this isn't just happening once a day and then the body can heal as it usually can. If this is going over and over and over again, there's a lot of trauma. There could be a lot of bleeding, the forming of sort of scarring tissue. So it's quite exciting that now you see a catheter on the market that's part of the third generation of catheters, where it's different that it's not hydrophilic coated. The surface itself is hydrophilic, so there's no coating. In the test here that we have used based on published and peer-reviewed testing methods in a biomimetic model, we grow a cell monolayer of urethral epithelial cells and then seed it onto pre-formed PDMS or silicone sheets. And this is really to mimic the urethra that there's to be tested up. There is a weight that has a pulley system also attached to the apparatus, and on the bottom of this weight we can attach them. The catheters are pulled at a constant rate across the surface of the monolayer. We take images of these sections of the catheterization tracts and measure them, as well as observe them for cell damage or cell health. If there was any damage caused to the monolayer or the cell catheterization tract, we would expect then cells to maybe be removed, and we can measure that in terms of percentage cells still left. We stained the surface of the catheters and looked for any cells that would adhere. If cells have been removed or damaged and removed from the cell monolayer, we anticipated that perhaps they were stuck on the surface of the catheter. And what was really interesting is that we've seen, particularly in some of the hydrophilic coated products that contain PVP, a lot more cell adhesion in terms when you compared to the GentleCath Glide product of FeelClean Technology. We had a closer look and examination in terms of the cells and their health. What was really interesting was that the uncoated first generation catheters came out with quite severe damage at the end. Then the second generation, the hydrophilic coated catheters, seemed to have sort of moderate damage, where what was really exciting was that the GentleCath Glide, the catheter with FeelClean Technology, only had slight to mild damage. What's really exciting about these results is the potential for these third generation catheters to cause less microtrauma to patients' urethra, and then in passing, less pain and less discomfort. If we were able to improve patients' quality of life, that would be fantastic in terms of causing them less pain, less discomfort, ease of use.